Okay, let's quickly talk about vaccines because many people don't know what vaccine is or why it is being applied. And then types of vaccine. That's why you'll be in the office and someone will just walk in and ask you for fowl pox vaccine. After giving the person the vaccine and give the person the lancet or the pin, she will start looking at you because she thought the fowl pox vaccine is given the same way as Gomboro or Lasota. But after this lecture, you'll be able to understand everything about vaccines. So even if you are sleeping and I call you Aisha or Ngozi or Funke, what is vaccine? You'll be able to say in details about vaccines. Now, what is vaccine? A vaccine is a type of medicine that will help train the body's immune system to fight a disease that it has not encountered before. Mark that word, it has not encountered before. Unlike drugs that is used in treating already existing diseases. That's the difference between drug and vaccine. The use of this poultry vaccine in farm is to aid in prevention and control of contagious diseases that will end up wiping out an entire flock if the disease invaded the farm or were found to be present. Vaccines are not meant for curing diseases, but for prevention purposes. That is why it is given before the birds are already down. So carrying out vaccination is an important aspect of poultry management. Effective preventive measures such as vaccination can help protect our birds from deadly diseases. Some people will say, I don't need it though. Is it not when you allow somebody enter your farm that they can transmit the disease to your birds? There is no how you apply biosecurity and you can use it to substitute vaccination. Never. It has never done that way. Now, how do vaccine work? A vaccine works by triggering or boosting the immune system of a bird to produce antibodies. The antibodies in turn fight the causative organism that will make the bird sick. The use of poultry vaccination in poultry farm is for minimizing the emergence of diseases that would cause a lot of losses for the farmers. Take for instance, you have two pen, that is two poultry houses, A and B. Then you decided to vaccinate birds in pen A and then you will not vaccinate those in pen B. And there is a breakout of a Newcastle disease in your two farms. What you see in pen A is sometimes they will start showing you signs like codling, loss of appetite, cough, low mortality rate. You will be seeing maybe every day you pick out one bird, one or two birds, which will happen for days. But in pen B, we are going to what you're going to see, maybe one day you wake up one morning and you see that 40% of your birds are gone and the rest are very weak. Yes. Now, using these two examples, we can see the advantage of vaccine in poultry businesses. Now, let's talk about how to handle this vaccine. There are things to look out for when you want to buy vaccine. Number one is the vendor. You ask yourself, do they constantly have light? Or do they only on their refrigerators when there is uh, light within the neighborhood? I am very sure in this part of the country, we don't normally have constant light. So always go to vendors that have constant electricity or frequently make use of their generators. Now, when you receive the vaccine, check if it was in cold chain or they put it in something like ice pack or ice block for you It is a must. Now check for the type of vaccine you ordered for. Sometimes you pay for Lasota because of mistake, they will give you Gomboro. You go and mix it up at home. So you have to check it there to make sure. Then don't forget to check for the dose. Imagine paying for 1,000 dose of Lasota and they ended up giving you 100 dose to vaccinate your 1,000 dose, 1,000 birds. Always check out for vaccine expiry dates. It's very necessary. If the vaccine bottle, in the vaccine bottle, the label have peeled off, ask them to give you another one or refund your money, except you trust the vendor. Another one, get a vaccine flask for yourself. It will not cost you 2,000 naira. This flask is very necessary. Make sure you get it. Now, there are rules you have to obey while during vaccination. Do not vaccinate birds that are showing signs of disease or stress. Don't try it. Do not vaccinate sick bears. It may end up wiping out the whole bears or the vaccine may fail. Vaccinate when the temperature is low, either in the morning or in the evening. Withdraw any antibiotic 3 days before your vaccination date. And don't forget to use anti-stress to help relax your vaccine during vaccination time. You can ask for BioVita stress or any related medication during vaccination. Ensure you stay around during your vaccination so that you'll be able to remove the remaining water immediately and introduce them another clean water. Withdraw water 1 or 2 hours before vaccination and make sure there is food in their feeders. This will make your vaccination very effective. How? Imagine them eating for 1 or 2 hours without water. So when you finally give them the vaccine, they will rush it because they are already thirsty. So it will make about 98% of your birds consuming the vaccine. Never use tap or chlorinated water or water mixed with iodine to vaccinate your birds. Reason, because chlorine kills the strength of the vaccine. Now, route of vaccination in poultry. The most commonest one is what? Through drinking water. This involves administering the vaccine through drinking water. It is the most preferred method because of the ease of administration and does not require much labor. To encourage water intake during this method of vaccination, like I said before, withdraw the water for an hour or so before intended vaccine is given. This way, you are sure of all the birds drinking the vaccinated water when it is given because they are thirsty. We also have other routes like intramuscular, subcutaneous, aerosol, but any of these are none of your business. When it gets to this level, call your vet. Thank you for listening. Next time, we'll talk about common diseases in poultry. Example, we are going to discuss Newcastle disease.